audience as well, and we're always going to talk about something preventive health. And it was suggested to me that we talk about some diabetes today. So I think we'll start off talking about diabetes.
Okay, that'll be just great. I know that a lot of people really suffer from diabetes, and they don't really understand what's going on and know the symptoms or the cure. So I'm sure you're going to tell us about it.
Well, diabetes is a big disease. It's a big disease in all the populations, but it's actually highest in the African American population, and it's actually highest in the southern part of the United States. And so when you talk about diabetes, it often runs hand in hand with hypertension, as well as strokes, as well as high cholesterol, as well as heart disease. So those group of diseases, they often are running hand in hand and neck and neck. When you find a person that's significantly overweight and they have diabetes, the chance that they're not going to have hypertension is not very high. Diabetes and hypertension many times will run together, and they have a strong association with weight, have a strong association with high cholesterol, they have a strong association with smoking. So there's some things that we know about diabetes and the other chronic medical problems that we deal with on a routine basis. And the goal is to, how can we maximize our health? What can we do on a daily basis on our own without having to see our healthcare provider that can decrease our incidence of diabetes? Okay, so let's start back with the kids. We've got a marked increase of diabetes in children under 15 now. It used to be when children got diabetes, they got type 1 diabetes, meaning they're totally insulin dependent, meaning their pancreas is not working like it should. But now we have a lot of type 2 diabetes in children because, why do you think? Supersize.
Overweight.
Overweight, supersize. When you go to McDonald's, what do you get? A supersize. You go to Burger King, what do you get? Supersize. And so you can get twice the amount of fries for just 1.5 times the money. And so that, as an advertising employee, many people are supersizing things. When you go to the food store, every corner is going to be a gimmick item. So when you go to the food store, you go shopping, 80% of what you need is around the outside of the store. And understand, every aisle is going to have a gimmick item. And it's usually going to be something that's high in fat, high in sugar. Those are usually going to be your big two. Salt might be one of the catch items because on your tongue you have a place for salt, fat, and sugar. So those are, when I make an item in my factory, I need to make it appealing to you. And the way I make it appealing to you is I got to hit one of those big senses, the salt, the sugar, or the fat. And so you have places on your tongue that will respond to that. And so when you go to that food store, and you should have your mind made up before you get there. So don't walk down every aisle and see what you saw on TV and what you think you might like to try, but have your mind made up already what you want to do. And that's a very poor way to go shopping, go down the aisles and see what you might want to try. When you go down an aisle, already have decided what you're going down the aisle for, so that you don't end up getting stuff that you don't need. Now along that same line, you want to read your labels. Pick up the item, whatever's first is what's most. Okay, if the first item is sugar, that's what's most. The first item is water, that's what's most. Whatever's most is what's first, and then next, and so forth down the line. So if you pick up a product over the shelf and the first item is sugar, next item is cornstarch, next item is another sugar, well, you probably want to leave that item on the shelf.
Okay.
But as where if you pick up something on the shelf and it doesn't flow like that, then it might be a much better item. So take cereals, for example. The cereal is going to be, your best cereals are going to be on the top shelf or bottom shelf. Why is that? Well, because that's the people that are more interested in their health are willing to work a little harder. The more gimmicky cereals are going to be at eye level for the adults, and the other ones are going to be at eye level for the kids. But if you're after some good cereals and you're an adult, there's usually going to be on the top shelf. And one way to pick a cereal is pick up the cereal box and see, does it have 5 grams of fiber or more. If it has 5 grams of fiber or more, it's probably going to be pretty good. So that's just kind of a rough guesstimate there.
Well, doctor, are you saying that the more fiber, the more healthy it is for you?
Absolutely. It's usually, and that's not, I said absolutely, so it's not absolutely. But there's a strong correlation. When a product has more fiber, it's usually going to be healthier. That's a good correlation to make. In cereals, it's probably going to be true. Other foods, it may not be so true. You have good foods that are high in fiber, but you also have to be aware of the different gimmicks. You might pick up some peanut butter, and it might say cholesterol free. Well, Peanut butter never had cholesterol in it in the first place. Cholesterol comes from an animal product. So you have to be aware of the way that advertising does and the way the gimmicks take place.
Yeah, well, a lot of the audience doesn't realize that these companies are really out to make money. They don't really care about the health of the consumer.
Well, I don't know that they don't care, but a person has a business to make money. They don't have a business to go under. So, I mean, I'm not saying anything against the companies making money, because they should make money in order to survive. But you have to become aware of what the labels say. That's what we're describing here. Say, like, for example, margarine. Well, all the margarines in the past used to be hydrated, and when you hydrate a margarine, an oil, it turns it into a trans fatty acid. Well, trans fatty acids are triggers for cancer. So obviously you want to stay away from those. But now I might have olive oil, which we know is one of the best oils, and it might be margarine made from olive oil. So we'll look at it, we'll pick it up, we'll say, oh, margarine made from olive oil, this must be a great product. But then if you read the label, if it says hydrolyzed, well, now you took a great product and you turned it into a bad product. So again, in all that get an understanding, and that's one of the things we try to do with this program, is to give our listening audience an understanding of what we're talking about. Now, another easy, quick example will be when you talk about how things are best. Fresh is usually best, frozen's next, and then canned would be worse. So that's kind of an order you can usually use as a good rule of thumb. So let's get back to diabetes. So children are having a much higher incidence of type 2 diabetes. Type 2 diabetes refers to diabetes that your pancreas is still putting out insulin, but your body is not responding to it well. So most diabetes now is not just because you don't have enough insulin, but because your cells are not responding to the insulin appropriately. So when you have when you have diabetes and you have a lot of sugar floating around in your blood, well, there's a lot of mechanisms that take place at the cell level that take that sugar into the cell so that cell can utilize that sugar for energy. Now, for example, your brain lives on energy. Your brain lives on about 80% sugar, but you just can't dump sugar in and think that's going to be good. So now, when that sugar gets to the cell, now the cell has to have a certain mechanism to take that sugar into the cell, and this is why we usually refer to diabetes as an insulin-resistant type of disease, because insulin is like the key that opens the door and then allows the sugar to flow into the cell. But if that cell becomes insulin resistant, well, now you put the key in the lock, and the lock won't open. The key won't open the door. So now we're going to have to get into that cell a different way, and that's what we say when we say insulin resistant. Your pancreas puts out insulin, but it also puts out some other things that help in diabetes. That's kind of a rough mechanism of why a person becomes diabetic. A person can be diabetic whether they're skinny or overweight. But the overweight person is much more likely to become diabetic because of their having an increase in that sugar load. And
but doctor,
go ahead.
Is it possible that diabetes is hereditary?
Absolutely, there's an hereditary component, but that's kind of a smoke screen. Most people want to say everybody in my family's got diabetes, so I knew I was going to get it. I would wager to say to you that probably 75% of people that come down with diabetes is probably environmental. And what am I saying when I say environmental? Well, how do you eat? You usually eat the way your mother eats. How does she eat? She ate the way her mother ate.
Okay.
And so how do you cook? You usually cook the way your mother cooked. And how does somebody else cook? They cook the way their mother cooked.
That still goes right back to being hereditary.
So we're back to environment. I always like the little joke they ask Grandma, well, why does she always, people grew up with eating ham, so they always cut the end off the ham and they cook the ham. And so finally somebody asked Grandma, well, why you cut the end off the ham? And they thought it was because that was the best way to cook the ham, and Grandma said because that was the biggest pot she had. Okay, so you can see that things take place we do things by observing. You observe your mother cooking a certain way, you'll cook a certain way. I know I grew up eating liver, which was awful, and bacon, which is awful. I used to have to have a piece of bacon and have the piece of liver, but we had that frequently. Frequently had hot dogs at my house, so I grew up not eating well, again, because my mother didn't know any different to feed us any different, and until I learned better, I ate that way. And so as you learn more, then you can change your habits. But this is why I tell people in all that get an understanding. That's why this program is so important to so many, because I'm hoping it will be a springboard for you to get some new information, to dig a little deeper, and know that you don't have to do it just the way your mom always did it. Your mom may have done it great, or your mom may not have done it great. But you have to open yourself up to some understanding that it could be done differently. So back to that hereditary component. Absolutely, there's a hereditary component. Diabetes, hypertension, many other things have a hereditary component to them. But many times it's environment. So if you're eating a lot of junk food, eating a lot of red meat, you're overweight, you're not exercising, well, those are setups for diabetes. So are you going to say because you're overweight and eating red meat and you sit on the couch and watch TV all night that you got diabetes because of everybody in the family got it? Well, I would wager to say that you're going to be hard-pressed to convince a jury of that. And so when you talk about diabetes, it can come on at any age, but the more common age is by the time a person's reaching the 30 or so. 30 to 60 is probably the more common age to start off having diabetes. The young kids that have it, if you jump on their diet, get them into diet and exercise, you may can reverse the process, as well as with adults. If you're significantly overweight and you become diabetic and you drop the pounds, you may get to the place where you're not diabetic anymore. So what do I mean? Dropping the pounds is getting to a weight loss issue. And why? 68% of our country is overweight. And so that's not a simple task. You know, I do a lot with weight loss in the office, but I have very little success because people don't do what they're supposed to do when you talk about weight loss. So when I talk about weight loss, I suggest that a pound a week, 5 pounds a month, 30 pounds a half a year, 60 pounds a year is a good pattern of weight loss. And if you go much faster than that, your chance of success is going to markedly go down. And then we get programs like The Biggest Loser, and we see people lose 200 pounds in 3 or 4 months. Well, that's an absolutely ridiculous number, and it's a number that can definitely lead to death. I can assure you that when you have programs like The Biggest Loser, that those people have signed their life away, that if they die while they're on that program, the program's not going to be responsible. And they got the medical care and all those that are right there monitoring their blood, monitoring their heart, and things like that. That's a very unsafe weight loss. If you lose more than 3 pounds a week consistently, you're not in a safe zone. And so if you're going to be doing something like that, you need to be monitored. You need to be having your blood checked. You need to have a nutritionist working with you, maybe somebody that's working with you on the exercise, and all those components have to come together to make it safer. But it still would not be a good method. The faster you lose, the more likely you are to regain it. You have to think of weight loss like a microwave and a crock pot. Okay? If you put the chicken in the crock pot, it'll cook all day and it's still doing good. You put the chicken in the microwave, it's scorched in 10 minutes.
Yes,
and so weight loss is the crock pot. The microwave is trying to find a pill and have a quick fix. I probably have that conversation twice a week with a patient. Doc, can't you just give me something to lose this weight? Doc, can't you just give me something to lose this weight? And so I have to try to break it down and try to give them an understanding that that's not what you need. You need a lifestyle changes. You need to drop the weight slowly, because if you drop it fast, you're going to gain it back. If you're weighing 250 and I get you down to 150, well, you don't know how to live at 150. You've been living at 250. And so now you're trying to live at a place that you don't know how to live at. So you're going to just gradually go back, or you may go back fast. And yo-yo dieting is never good. Okay, so back to diabetes. So if you're diabetic, and every time you drop, and this also applies for hypertension, every time you drop 10% of your body weight, you'll have a dramatic effect on your hypertension and your diabetes. Now, if you're not overweight, then that's not going to be a tool that you'll be able to utilize very well.
Okay.
But there's a thing called the glycemic index. The glycemic index describes the way the sugars, your body responds to those sugars. And you want foods that are low in the glycemic index. And if you can look it up on the internet. I don't know if I have it on my website or not. It might be on my website. If you go to my website at AskDrFerguson.com, go under frequently asked questions, and I might have the glycemic index, some different foods that fall into that category on there. If not, go to your Google search window, type in glycemic index, and that will bring up a list of foods that are good for diabetics. And one of those foods can be a chocolate cake. Chocolate cake is high in antioxidant because that's what the chocolate is, and it has a good glycemic index number. So you always want to, in all that get an understanding. Some of your fruits are not will have a worse glycemic index than maybe your chocolate cake does. So you have to look at the different items and look at them individually. Now, the other thing that when you talk about diabetes, you want to have starches as opposed to simple sugars. Starch is a complex sugar. So think about, you know, you go to a auditorium and where they have the chairs hooked together.
Yes, sir.
And you got a whole row, and you got to sit real elbow to elbow to somebody because the chairs are hooked and you can't move them. Okay, that will be the starch. Okay, now you get somebody come in that's smart enough that lifts up one before the row, before people get to sitting, and now you separate the chairs. Now you can give yourself a little elbow room, and now that will be a sugar. So you've separated one of those chairs off from the group of chairs, so now you got a simple sugar as opposed to the starch. Now, when you take starches into your body, that what happens is your body will break that down slowly, and so the sugar will move into your system slowly. But when you eat a candy bar, you're going to get the simple sugar, so you'll get an immediate 15 to 20 minute jolt, and then you'll get a drop. So this is why it's always better to get the things that are going to go in your body slow and steady. This is another place where fiber comes in. Fiber is going to help you absorb the foods slow and steady. That's why fiber is so important.
And Doctor, I hate to interrupt you, but I'm dying to know, and I'm sure some of the listening audience is also dying to know, does diabetes have symptoms that you would be able to tell that something is just not right?
Absolutely, diabetes has symptoms. Many people are going to have diabetes if they don't see a doctor regularly, probably 5 to 10 years before it's diagnosed. Diabetes is associated with increased thirst, increased having to urinate, maybe not feeling the greatest. But see, this comes on gradually. This doesn't just come on, boom, 1 minute you're one way and the next minute you're another way. It comes on gradually. So when you're talking about as diabetes is getting worse, that's when you begin to see some of these symptoms. That's why a person can have it 5 to 10 years before it's diagnosed.
Okay.
Oftentimes,
being facial, which we all know that it is, what are some of the other detriments?
well, but many times by the time a person presents to me and they're not presenting to the doctor regularly, they're complaining of increased urination and frequency in urinating, many times complaining of a dry mouth. Those would be two things that would make me think about diabetes right away. Maybe they're referring to their eyesight is not as sharp as it used to be, and their memory is not as good as it used to be. Those things also could be contributing factors to diabetes. When you get there gradually, you'll have the symptoms gradually. If you all of a sudden you're not diabetic and all of a sudden you have a sugar of 500, well, that might be enough to kill you. But generally, by the time a person has a sugar of 500, they gradually got there. They didn't just get there overnight. And so when we begin to treat diabetes, we also have to take them down a little slow. A lot of times, if I get a person to the normal range too quickly, they feel bad because they're used to being high. So many times we have to get a person to the normal range slower. Always treating, and always there's a number we call hemoglobin A1C. That's a reflection of what your blood sugars are running. Now, at a hemoglobin A1C of 6, that's a reflection over the past 3 months, your blood sugars have been 120. Hemoglobin A1C of 7, that's 150. Hemoglobin A1C of 8, that's 180. Hemoglobin A1C of 9, that's 210, and so forth. It goes up 30 each time. And so when a person comes to me and I'm beginning to treat them, and I do their blood work and I do a hemoglobin A1C and it's 15, well, that tells me their sugars have been running 400 or 500 off the chart for probably a long time. But they're sitting there talking to me and they really don't know that they feel bad. One of the remarkable things, and it's always so interesting to see, when a person presents to you and their sugars are running really high, they've never been diagnosed with diabetes, they don't realize that they feel bad. And so what happens is you treat them and you get their numbers back down to normal and they say, man, I really felt bad. I didn't realize how bad I felt. And the reason is because they got there gradually. When things happen gradually, you'll have an experience where you don't really realize it's happening. You become
just feeling normal, maybe right. Sluggish, but
right. You become desensitized.
Yeah.
Desensitization is a great advertising tool. I was looking at a commercial not too long ago, and in the 1930s, I think it was 1932, they would go on the beach with a ruler, and if the lady's bathing suit was above her ankles, they could get a ticket and even taken to jail. But think about that, a bathing suit above the ankle. Now you have trouble finding the bathing suit sometimes.
Wow.
And so, again, it's called desensitization. In the 60s and 70s, if you saw somebody shot on TV, it might be dramatic. now we see that on the newscast every night, and we just keep doing what we're doing. Again, we've been desensitized. You know, when I was out in Vegas, you know, they always push the envelope to the next level, usually before other people do. I mean, there's tons of billboards where they're advertising one of your popular soaps, and ladies are in their underwear. Well, why do you need to be in your underwear to advertise a popular soap? And these are big, you know, 50-foot billboards, you know, on the major thoroughfares. So it's because our society becomes desensitized to things. And when we become desensitized and we don't pay much attention to what's going on, and we say, oh, it's no big deal, it's just this, it's just that. You know, alcohol is another one of those big ones. You know, alcohol became legal back in the 1930s. Why? Because they wanted the tax money, not because it was good for you. And so people become desensitized to the fact that alcohol is really not good for you in the first place, but it's legal, so you do it. You know, we're going to have that same argument for marijuana coming up soon. It'll probably be legal in most states by the next 10 years. And so, again, we're talking tax revenue. It's not talking about good for you. You know, marijuana is the springboard for most people to get into harder drugs. A gateway, a doorkeeper. I mean, so you have to understand that we many times become desensitized to things. Now let's go back to diabetes we're talking about today. And those of you who want to catch us live, you can go by my website at AskDrFerguson.com. Click on the middle of the page. There'll be a live radio. Then you'll get to YouTube. Then click on feed. Then click a little house at the top left-hand corner. And then click on feed. You can catch us live. For those of you who want to call us and get more information from us, you can always call the office at 252-332-6484. We're always happy to see new patients. We do a lot with preventive health. We do a lot with Alzheimer's disease, natural hormone therapy. We have a substance abuse clinic and things like that. And they have lots of presence on the internet. You can go by the YouTube site, youtube.com/AskDrFerguson. Have about 170. No, I think at last count there's 200. There's over 200 videos there. Some are on Alzheimer's disease, substance abuse, a ton of different topics.
So there's enough information out there.
Absolutely, and also, and I didn't realize I had been doing my YouTubes live for so long. There's almost a year's worth of YouTubes that are archived there on that site as well. I just noticed that the other day. That I had almost a year's worth of YouTubes there that are archived. So those of you who enjoy this program today, you can always go to the YouTube and get more information. So back to diabetes. We've got lots of different treatments for diabetes, but this treatment starts with you, the individual. It starts with diet, exercise, and lifestyle changes. So I'm not going to really talk about the medicines because you're not going to give yourself the medicines in the first place. That's what your doctor or your healthcare provider is going to do. But what can you do? You can get your health in order by drinking more water. If your kidneys and your heart are working fine, a half a gallon of water a day is a good starting point. A person who weighs 150, well, okay, water. I always got to break down water a little bit. The way I tell you how much water you need is take your ideal body weight and try to make this simple. So, for example, if you weigh 150 pounds and you divide that in half, that's about how much you weigh in kilograms. To make that same number equal to ounces, and that's about how much water you need a day to sit on the couch and watch TV.
Wow.
So that's 75 ounces for somebody who weighs 150 pounds. 64 ounces is a half a gallon. So your water is critically important. Men 65% water, women 55% water. If you're not drinking enough water, you're out of balance. Water is the basis of you having healthy living. So water is always super, super important whenever you're talking about any part of diet and exercise. So you get your water right. Okay. Now what else do we need to get right? Well, you need to watch the red meats. The red meats are high in saturated fat, and saturated fat, some of that's going to get converted, stored as fat, and then some of that also can be converted into sugar in your body. It's not. And so you want to try to avoid that. So chicken, fish, and turkey, baked, broiled, steamed, or grilled, not fried. I like to use the Bible as the jumping board to describe how we should eat. And up until Genesis 1:29, we were vegetarians. Well, actually, in Genesis 1:29, that's right after God created everything, and man was a vegetarian. But in Leviticus 9:4, I think, or 4:9, one of those two, after the flood, then God introduced meat into the diet. So when a person says they're a vegetarian, well, that's okay, but that's not the way the Bible describes it. I like to do the things the way the Bible describes it. So you want to try to avoid the red meats. If you go to my website, go to frequently asked questions, you can say the Mediterranean diet. You'll see the food pyramid in the style of the Mediterranean diet. The Mediterranean diet is probably one of the most studied diets in the world and probably one of the best ways to eat. So In the Mediterranean diet, it's really low in red meat and sweets, really high in fruits and vegetables, really high in things like olive oil, high in fish, things like that. But eggs are high in cholesterol, but eggs aren't bad for you. A few eggs a week are going to be just fine for you. Every cell in your body has cholesterol. The key is you want to have a balance of your cholesterol. So don't just hear the word cholesterol and think bad. You have to have cholesterol, but you want the right balance. You want a high HDL, which is your good cholesterol, and a low LDL, which is your bad cholesterol. And you want those ratios to be in the proper ratio. So in all that getting understanding is so, so important. Now, back again, we're talking about diabetes, but all of these things are interrelated to diabetes. And now when you begin to exercise, you'll also get your sugars under better control, and you'll help your body utilize those sugars better. You'll decrease the insulin resistance that the cells are having, so more sugar will be able to get into your cells. So if you've been a couch potato and now you begin an exercise, monitor your sugars closely because you may need less medicine.
Doctor, I hear you continually mentioning cholesterol, and we know that high levels of cholesterol can lead to other complications. But what is the correlation there? Is there any key component that?
Well, the correlation is that many foods that are high in sugars are also high in cholesterol. And so that the correlation is, if you start getting healthier foods, they'll be lower in sugar and they'll probably be lower in cholesterol. But understand, cholesterol comes from animal products. So if it's not an animal product, it's not going to have cholesterol in it.
Exactly.
And so this is where, again, advertising comes into play. That's why I mentioned that example earlier. It might say peanut butter, cholesterol free. Well, people say, oh, that's good. Cholesterol, no cholesterol in peanut butter. Because my doctor told me my cholesterol was high. So they grabbed that peanut butter, but it never had cholesterol in the first place. So again, that would be an advertising ploy. Again, the goal here is in all that get an understanding. Chicken, fish, and turkey, baked, rolled, steamed, or grilled, not fried. Those are kind of a good basis, but your body needs proteins, it needs carbohydrates, it needs fat, so it needs all those different things. But a balance is what you need. You don't want to be in excess in any of those things. Your muscles are made up of protein. You got to have the protein in order to have strong muscles. You got to have the sugars in order for your muscles to function properly, in order for your brain to function properly. But you want to get away from the simple sugars. Now, as school's starting back, let's jump on that a real quick second here. All you parents and grandparents that are sending your kids to school, don't give them the junk food. Start them off with some good food. Read the labels. If the first item is sugar, don't give them that. The Pop-Tarts, might as well give them a candy bar. The hugs, the Kool-Aids. Get away from those things that are high in sugar. The sweet tea that's nothing but sugar. You want to get away from those things. Those things are not good for your kids. The sodas don't taste sweet, but your 12-ounce can of soda has anywhere between 11 to 16 teaspoons of sugar.
Wow.
That's a bunch of sugar. If you got young kids, they shouldn't even know what a soda tastes like. No. Understand that kids will be just as happy getting a fruit as a treat until you start introducing the sweets into the diet. And now they're not going to want the fruit anymore. But you have these little ones that are coming along, don't give them the sweets. You potty train them, give them a grape every time they go. Give them a half a banana, give them a slice of an apple. And you make it exciting. You say, oh, you're going to get an apple, you're going to get an orange, and you make it exciting to them. They'll be just as excited about that apple as they will be about some M&Ms. So get away from the junk food on your kids. And the sodas, they shouldn't even know what a soda tastes like. I don't think my boys had a soda that I knew of till they were 14 years old. And what do they do now? They're both very healthy. If they go somewhere, if they had an option of, 50 drinks, they're probably going to choose water. And it's because of the way we brought them up. Neither one of them ever had a cavity. Again, because junk food wasn't part of their diet. And we made food exciting.
And Doctor, and I know our time is really short, and I want to ask one question. Being that diabetes, it can be hereditary, but we know it's treatable. Is it curable?
Well, it's curable in the ways in which we've just described. If you're overweight and you drop the weight and then you maintain a good diet, your diabetes will be under good control. Curable, I don't know if we can use that word. You could probably say if you're way overweight and you're not eating healthy, you drop the weight and begin eating healthy, will you still need medicine? Probably not. Let's jump to that quick things. A couple things you can do. Chromium, I usually recommend 1,000 milligrams a day. That's a mineral. That can help stabilize your blood sugars. Really good for blood sugars. And if you go to my website, we've gone the whole show and I didn't even mention any of the things on my website. We've got some great products on my website for diabetes. Go to my website, AskDrFerguson.com, click on BioSlife for any of the derivatives of BioSlife. BioSlife has 2 patents that lower the serum cholesterol. It lowers the hemoglobin A1C by about 0.6 to 0.9, which is the same you're going to get from a prescription medication. So pretty significant. If you're interested in trying to do things naturally, I know we're coming to the end of the program, so if you have more interest in trying to get that diabetes under control with natural things, give my office a call at 252-332-6484. For those of you who are across the world, you can email us, you can talk to us, go by the website, contact us, interact with us that way. And, I know we're at the end of our program, but again, I want to say to all of you, have a blessed and wonderful day. Don't forget to tell your friends to tune in Wednesday, 9:30 to 10 on the internet as well as on the radio. And we'll come to you again with something preventive that you can do right now while we speak. Don't have to do anything else to do those things. All right, well, you be blessed and have a wonderful day.
Thank you so very much, Doctor.
Bye-bye.